if I have a capacity to find out a rogue cell in you, each one of us is about 15 to 20 cancers every day, but they don't become clinical cancers, they all die out. Took patients with severe pain. Take, for example, cancer pain. And they ran a drip of morphia. All of us know morphia is the best painkiller, right? Any dispute about it? No. And told the patient, this is not morphia. This is a new vitamin we have found out for your disease. And you will be all right, but your pain may not go. 88% pain did not go. Okay? So they crossed over. They took the patient to the other side and they ran a saline drip, and told the patient, this is a morphia salt, new salt of morphia, and you will be fine. Their pain, shocked, what is happening? This is what I have been telling Sri Hegde when he was very young. He was 28, I was about 38 at that time. I was a professor, I was telling him, look, he asked me one day, a lot of patients come and ask me, doctor, whether he'll be all right with this. I tell them they'll be all right. Now, am I telling a lie? So I told him, no, you are telling the correct thing. Keep telling that. Because, Abhaya, because he is called the talking Manjunatha. Manjunatha doesn't talk. No? So people believed, people had faith in him, Faithith. And when he says, you will be all right, that's called the placebo effect. And this study showed it is a placebo effect only that works. I'll show you how. So they repeated the whole study with an fMRI, concurrent fMRI. And what it showed is, when the patient did not believe that it is morphia, though it was morphia, because he had faith in the doctor, he did not believe it is morphia, his forebrain slept. When the patient believed saline was morphia, his forebrain produced so much of opioids that the pain disappeared. This study went on for 4 years. Lot of patients, lot of money was spent. And the paper is there for you to read. You won't read that, I know. Paper is called the placebo effect. It's in a very prestigious journal called Science Translational Medicine, STM, which is Cousin of Science Journal itself. March 11th, 2011. Please read this paper. Be a good human being and patients will be fine. Now I'd like to tell you a little about health. Can I have the first slide, please? I was telling you, this is not a healthcare business that you're doing. Remember that? I would like here CIE on sickness care future or business or whatever you want to call it. It's not health at all. Because you're not doing anything for health. Health, well, I'll tell you what are needed. Nothing to do with healthcare. Or we are not doing anything to health. Alma Ata definition doesn't define health. But the real definition of health which we gave and the IOM has accepted it is a state of it's no next. Anyway, don't worry about that. The slides go up and down. Health is enthusiasm to work and enthusiasm to be compassionate. So get up in the morning, ask yourself, do I want to go to work today? If the answer is absolute yes, you are healthy. You don't have to check yourself. If you say, do I have to do something good to others? If the answer is an affirmative yes, you are healthy. Does it mean you don't have a disease? No, you have a disease, but you are healthy. You may have a disease. As I told you, if I have a capacity to find out a rogue cell in you, each one of us is about 15 to 20 cancers every day, but they don't become clinical cancers. They all die out. Today we know, the cancer specialists themselves know, that quite a lot of cancers are not really not cancer. Half the breast cancers, what's called ductal carcinoma in situ, is not a cancer at all. Leave the woman alone, she will live 100 years. Treat her, she will be dead in 5 to 10 years. Prostate cancers, now even the government of America prevents testing for PSA. And you think you can detect diseases very early? When is early? A cancer takes about 30, 40 years from the rogue cell to become a cancer. When are you catching it early? There's nothing called early. Because in that time, the cancer has seeded all over the place. And if it wants to be vigorous and bad, it can be bad. So recently, Tata Cancer Hospital, they had an international conference on cancer. And they called me to inaugurate that. I told them, you know my views. He said, that's exactly what we want. So I went and told them exactly what I felt about cancer. I said, 85% of your research is fraud. They were shocked. But do you know what happened after that? The president of the American Cancer Society, who is a Nobel laureate, Harold Warmus, and Rajendra Badwe, who is the director, they came to my room in the Taj Palace. They said, sir, what you said is right. We have to change it. What do we do? So they're going to have a conference on contrarian views in cancer in Paris next year. They want me to give a keynote address. And I told Tata Cancer, have a palliation unit. Give the patient a choice. I'll give you alternate treatment. You can, or I'll give you my treatment. Which one would you like? And if the patient takes the alternate treatment, today, now the whole unit, they started after 3 months. I inaugurated that unit also, and it's full. There's a queue. And 5 doctors from mainline cancer hospital in Tata have left and come to the palliation care. You give them TLC, tender loving care. I'll give you an audit. Christie's did an audit. Christie's is the oldest cancer hospital with records from 1841. 2 slots, 1900, 1940, 1950, 1990. 1 cancer, chronic myeloid leukemia. 1900, 1940, we only had TLC, tender loving care. 1950, 1990, we busulfan and so many other things, splenectomy, what have you. And the per capita deaths were slightly more in the second half than in the first half. I'll give you a reason. Human body is not linear. Every day you give busulfan, but the mother cell of the white cell produces millions of white cells one day and then sleeps for 3 months. But your busulfan goes in every day. In the evening, 4 milligram goes in. On the day it has produced lot of cells, it does good. On the other days, it damages all the body cells. And we are killing them a little earlier than they would have otherwise died. So there are a lot of things. If any one of you needs, I will give you a letter which Rajendra Badwe wrote to me about the inside story of what's happening in the cancer area, cancer arena. Because cancer is a big industry, $1.72 trillion industry. Can you believe that? Trillion, not billion. So all this is not told to doctors. I really pity doctors because we get only certain controlled education in the medical school. Do you know who writes your textbooks? Please go and read this editorial in the Lancet, March 1997. It says, medical education America is run by drug company and device company money. The textbooks are ghost written by the drug company, and a professor's name is borrowed for money, and it's put so and so's textbook of medicine. He has not even written, he has not seen that. And how do they write? Whatever is convenient to them, they write it. All this must stop. I think TIE can do a lot because we Indians have the highest ethics in this world because we have what our dharma. Do you know what it says? You must do to others what you would like others to do to you.